Okay, so at this point in time, I'd like to introduce some of our speakers. You notice to my right, we have two folks here. This is Sherry Gregory on the far right. Everybody say, hey, Sherry. Hey. And this is Ashley Deverell. Everybody say, hey, Ashley. Hey. Sherry is my next door neighbor. Don't hold that against her. She is a wonderful person who's doing a lot of great things for our area. I'm going to read you a little bit of information about Sherry that you may or may not know. Sherry Gregory is the Infectious Disease Director for the North Georgia Health District. She manages the department that oversees and investigates all reportable and notifiable infectious diseases in the district, which is comprised of Whitfield, Cherokee, Pickens, Gilmer, Murray, and Fannin counties. She earned her registered nursing degree from Dalton State College and her bachelor's of science in nursing from Columbus State University. She is a healthcare professional and has worked in public health for 11 years. She manages the infectious disease program throughout the district, which includes our health departments and our Living Bridge clinics, the Ryan White HIV programs, offering STD testing, treatment, and education, as well as local private providers reporting infectious diseases. One of the areas of responsibility in her department is immunizations. This is the main focus of today's presentation by Immunization Coordinator Ashley Deverell. Sherry also manages the COVID-19 response team of 68 state employees, and at the height of the pandemic had 111 state employees working on COVID. This does not include the many district staff that has assisted locally with COVID and its impact. Sherry is a strong believer of health awareness and prevention. She is passionate about the opportunities to work with our communities to help educate and prevent the spread of infectious diseases. If you'd like any additional information, please feel free to contact her at the northwestgeorgiahealthdistrict.org site. Is that any better? Test. Okay, so this is something I'm learning about this microphone. Yeah. If it phases out, turn it off, and turn it back on. I don't know what's wrong. With that being said, let's give a hand for Sherry. Actually, if you want.
Thank y'all for letting us come today. I've got a loud voice anyway, so hopefully I won't blow you out with the microphone. We do a lot of great work here at the public health in our Dalton district, which, you know, it is kind of disheartening. Is that it? Okay. Sorry about that. So we're excited today to be here to share, especially with what's going on in our communities today. So hopefully we'll be able to provide any answers to any questions you might have. We've got a lot going on, especially with COVID having our third peak now. And so I brought the expert here to share with you about COVID, and not only that, but Ashley's over all of the immunizations that we have in our district, which is one of our main goals. Yeah, there we go again. It's one of our main goals with public health. Of course, immunizations are at the basis of what we do and the reason that we do it. So I'll introduce Ashley Deverell. She's our Immunization Coordinator from the North Georgia Health District. Ashley's responsible for all the immunization activities, surveillance, and that includes the vaccine preventable diseases. Ashley's also the team lead for COVID, our school team, and so she's worked quite well with a lot of the superintendents, principals, teachers, as we've seen several in the crowd today. So we're very excited to have her. She's actually, she became a nurse in 2012 at Dalton State College. She also graduated from West Georgia College. She has been part of the health district since 2012. And so we're so happy to have her, and I'm especially grateful to Ashley. She's definitely my right hand, and grooming her to take my place because I don't want to be doing this too much longer. So, Ashley, if you want to tell them about our project.
Let's go swap these batteries out, see if that doesn't help. We'll find out. So, yeah, Ashley, here's the clicker. You just point. Do it, you can go to the next thing. If you take that. Okay. That way.
Did you know? Don't hold a quiz.
I don't know if it's the batteries. I think there's something wrong. So it said it had plenty of batteries, strength.
Test.
Thank you, Bruce. Let's see if that did the trick. Here we'll find out. Ashley, it's all you.
Well, thank you very much for having me today. I'm just going to go ahead and say I am a nurse, not a public speaker, so just bear with me. So I wanted to start our conversation today just talking about the services that we have in our health department daily when COVID's not going on. You know, we want to be a resource to you even when we're not in a pandemic. So just as a reminder, it's here in town at 800 Professional Boulevard over by the jail. We do vaccinations, we do STD testing, women's health. At this time, we're doing primary care services, but that will be ending at the end of the year. So that is one service that we're not continuing. We also have a hepatitis C clinic where we treat those who are infected with hepatitis C. It's a great program. With the labs are the only cost to participate, so there's no fees for medication or follow-up visits with the doctor or the nurse. It's strictly to obtain those lab results to check your status. So it's been a great program. We are constantly trying to build that program. And keep trying.
Turn it off, turn it back
I was gonna say, I'll get closer if I need to. I'm a walker and talker anyway. This kind of throws me off. Let's see. Testing.
Yeah, that worked.
It worked?
Yeah.
Okay. Primarily among people who are in the drug community, people who are in prison. But it's spread. You know, there was people who were not in that community that were infected because of being close to someone who participates in that activity or just happenstance. So this program was really important to us. This kind of prepared us for the pandemic as much as something can prepare you for the pandemic. So what we did is we started a no-cost vaccination program. We wanted to take down, can everybody hear me back there? If I talk really loud? Okay. We wanted to take away barriers to vaccination. We wanted to make it accessible. We wanted to make it easy. So we did this advertising campaign for anyone. It did not matter if you abused drugs, anything. If you were an adult who wanted to be vaccinated, we were ready to do that for you. So we did a no-cost campaign. These were their high-risk groups, you know, people who use drugs, people who were experiencing homelessness. people who are incarcerated, men who have sex with men, and have other chronic liver diseases such as hepatitis C. So those are some of the high risk factors, but this was available to anybody that wanted a hepatitis A vaccine. Some of the outreach that we were able to do during that time, we went to all of our local jails, all 6 counties. We provided vaccinations to inmates. We actually had some outbreaks in our jails, which is kind of what spurred this relationship. Because of that, we've been able to go in and give COVID vaccines. So all of this started based on our partnership with the jails early on during our hepatitis A outbreak. We held events at homeless shelters, substance abuse facilities. We actually had all our environmental health staff, when they would go in and do restaurant inspections, give employees a card. Hey, have this card, come get a free vaccine, because we had a case in a local restaurant. I don't know if you guys remember, a couple of years ago, it was kind of all over the news. So we wanted to provide restaurants with that ability to kind of stop any potential outbreaks from happening, get all their employees vaccinated. We even went on site to a couple restaurants and did clinics. And of course, we also provided those no-cost vaccination cards just in the community for people to pick up and realize, hey, you can get a free vaccine at the health department. We also did some billboards. And this is just some data that I collected for a presentation that ended up being canceled due to COVID. But I just kind of wanted to highlight what vaccinations can do. We started out really low in our hepatitis A vaccination records, and we were able to kind of have those case counts go back down after that peak in July. So during that time, we were giving thousands of hepatitis A vaccines a month. So we were really hitting our target audience and getting tons of Georgians vaccinated. So just wanted to show that.
Was that July of 19 or July of 20?
That was 20. Or no, I'm sorry, 19. The years are getting away from me. I've lost all track of time during COVID. So Smitty mentioned to me that one of the missions of the Rotary Club is to end polio. So I wanted to prepare a slide. I know you guys probably know some of this information already, but just wanted to go ahead and talk about it since it is one of the missions of the Rotary Club. So currently there's only 2 countries in the world with polio still endemic, and that's Afghanistan and Pakistan. Nigeria did not eradicate polio until 2016. So 3 countries in the last 5 or so years. So currently CDC recommends the polio vaccine as a 4-dose pediatric series to be completed by age 6. So this is part of any child standard vaccinations. Typically even given in a combination vaccine to reduce the number of injections that they're getting at one time. A lot of times it's paired with a tetanus shot, for instance. Because polio still exists in our world, vaccination is still recommended. So if anyone asks you why are we still vaccinating for polio, it's still around. And we don't realize sometimes how privileged we are. All it would take is one international trip, one international flight, and polio could be back in our country. So it's just a good reminder that until it's completely eradicated, that's still a threat to us, even in a small way. So I did want to give you guys an update on the Tdap, which is the tetanus shot that also contains the whooping cough component. Quietly, right before COVID, the ACIP, which is the Advisory Committee on Immunization Practices, met, and they had advised that the TD, which is just the tetanus component, and the Tdap, which is that component that has the whooping cough, can be used interchangeably. So typically, I know us adults are not the greatest about doing this, but you're supposed to get a tetanus shot every 10 years. So instead of getting just the TD, which is your tetanus booster, you now have the ability to get the whooping cough component, which protects your grandchildren, protects your other members of your household. That is one of the diseases that I still investigate. I do investigate several herpes cases per year. And sadly, a lot of times people have been coughing for weeks and they finally get a pertussis test and they realize what they have. So it's just important. I just wanted to mention that because, if you go and want to get your tetanus booster, I would ask for a Tdap. They should be offering that to you as a standard of practice, but just keep that in mind, to get a Tdap instead of a TB. And as I mentioned, for the whole country, there's about 15 to 20,000 cases per year for pertussis, which is whooping cough. Okay, so back to COVID. So these numbers are even higher now than when I made this slide last week, but I wanted to make sure this was ready for your presentation. So the state of Georgia has seen a 204% increase in COVID-19 case counts in the last 14 days. There has been a 50% increase in hospitalizations and 18% increase in deaths. So in the last 2 weeks, Whitfield County has had 272 cases, and it's rising daily. During that same time frame, our neighboring county, Murray, saw 154 COVID-19 cases, which is a big deal because Murray County is a lot smaller than Whitfield County. So I just wanted to share those numbers with you all while we're here together. And then there have been breakthrough cases. I know that's been kind of in the news. There have been breakthrough cases, although it's more rare than someone who's unvaccinated. But 99% of COVID deaths are in those who are unvaccinated. So a lot of the times people who do experience a breakthrough case typically have cold-like symptoms, very mild symptoms. Whereas an unvaccinated person may get pneumonia, may have trouble breathing, may have to go to the hospital, may pass away. So part of my upcoming slide is just promoting vaccination, tackling some of those questions you may have. So I really want to promote this part of that because there are people still dying from COVID-19, and we want to do as much as we can to prevent that from happening. So here in our health department, just the health department, not any private providers, have administered over 60,000 vaccines. As of August 1st, 34% of Whitfield County residents are fully vaccinated against COVID-19. You know, that's not where we want our number to be, obviously. We want it to be much higher. Cases are on the rise because of the Delta variant, and it's not too late. We are giving COVID vaccines every day at Whitfield County Health Department and Murray County Health Department without an appointment. And of course, those of you who work with me, you know, like our schools and other businesses know that we like to go off site and do things too. So if you have a business or a community outreach you want us to come to, Whitfield County Health Department is glad to come off site and do clinics. We typically do flu, but now we do COVID vaccines too. So we can schedule a COVID vaccine clinic for your place of business. We can come back and do flu. We're glad to do whatever it is to help you and to get everybody vaccinated. So just please keep that in mind, and I will have my contact information at the end. Okay, so why get vaccinated? Of course, it's going to keep you from getting COVID-19. And then if you are fully vaccinated and you are exposed, you do not have to quarantine. Now, I will say a caveat: if you have symptoms, stay home. We've got to keep everybody safe. But if you are fully vaccinated, you are not required to quarantine if you're exposed to COVID-19. Once you're fully vaccinated, you can start doing more. I know that's kind of changed with the recent CDC guidance. We're back to wearing masks, but it's just so we can keep each other safe and put this in the rearview mirror, hopefully. It's a safer way to build natural immunity. You don't have to get sick. With the vaccine, you have very mild symptoms after the fact. I know for myself personally, I had a headache after my second dose, and that was it. It's safe and effective. It helps protect yourself and others, and the vaccine will not give you COVID-19. So I just wanted to compare numbers because people like to compare flu and COVID. So if you look at these two tables here, we had to use a previous flu season just for reference because last year we were all wearing masks and loving hand sanitizer and doing all these things. So naturally our flu counts were a lot less than in previous years. But just comparatively, we've had over 800,000 more COVID-19 cases than a normal flu season. There have been 18,000 more COVID deaths than a normal flu season. And there have been 65,000 more hospitalizations due to COVID when comparing to a normal flu season.
And then the last part of my presentation, I just want to tackle some myths and questions, and we're more than happy to answer questions at the end. So vaccines are made from aborted babies. COVID vaccines do not contain any aborted fetal cells. Fetal cell lines are not the same as fetal tissue. These are fetal cells that have grown in laboratory. They were grown in the 60s and 70s, the ones that are used today. Vaccine development using these historic cell lines do not require or request a new abortion. These cells have been grown independently and are not the direct cells from an aborted child. And then furthermore, Pfizer and Moderna do not use fetal cell lines in their vaccine.
No microchips either.
No microchips either. In all seriousness, if you're concerned about a microchip, most of you have one in your pocket on a cell phone. It knows everything we're doing right now. I mean, it's probably going to show you all kinds of COVID-19 advertisements after I get done talking. So, the vaccine will change your DNA. COVID-19 vaccines do not change or interact with your DNA in any way. What these vaccines do is they deliver instructions to your cells to start building protection against the virus that causes COVID-19. The material never enters the nucleus of your cell, which is where your DNA is kept. This means that the genetic material in the vaccines cannot affect or interact with our DNA in any way. All COVID-19 vaccines work with our body's natural defenses to safely develop immunity to disease. This is a big one for me that I have to answer quite a bit. It will make you infertile or miscarry. There has been no proven evidence that these COVID-19 vaccines affect your fertility or your ability to get pregnant. Among women with COVID-19, pregnant women were 5.4 more times likely to be hospitalized, 1.5 times more likely to be admitted to the ICU, and 1.7 times more likely to be put on a ventilator than a woman who is not pregnant with the illness. Getting COVID while pregnant can cause preterm birth. If you're trying to become pregnant now or want to get pregnant in the future, you can receive the COVID-19 vaccine. All animal studies that have been performed on COVID-19 vaccines have not shown any negative impact on fertility or fetal development. And then, of course, experts in reproductive health continue to recommend that the vaccine be available to pregnant individuals. And I know if you've seen studies, but even Pfizer has come out and said that getting the vaccine while, pregnant will give those antibodies to the baby. So, that's a great way to protect a newborn who has other defense. So just keep that in mind. And then myth, it has not been tested enough. So COVID-19 vaccines have went through the same review and testing as other vaccines. Sure, due to our pandemic, certain barriers to development related to funding and manufacturing were removed to get a faster process, but they still had to have the same safety protocols and perform the same testing that any other vaccine has to go through. It was just on an expedited process. But all the same reviews were in place. And we do believe that Pfizer will be getting its FDA approval pretty soon. And I'm sure Moderna would follow suit, but that is something that is going to happen. It will have FDA approval, full FDA approval, not emergency approval. So that is my email. I'll be glad to speak with anyone who wants to schedule any kind of clinics. Anything I can do for you, I would be glad to do. Anything else to get this pandemic behind us, so please reach out to us. And if we have any questions, we'd be glad to answer them.
Does anybody have any questions they'd like to ask Mr. Sherry?
Why don't you go over the recommended adult vaccine?
Sure.
Those over 50.
If you're over 50, you definitely need a Shingrix. Even if you received the Zostavax back when, Shingrix is a better vaccine. It works better. You definitely are less likely to get shingles with the Shingrix versus the Zostavax. So definitely as someone over 50, that would be a recommendation. again, as I mentioned, if you have not had a tetanus booster in the last 10 years, strongly consider a Tdap. Because if some of you have grandbabies or grandchildren, you want to do everything you can to protect them. And again, if you've not had a hepatitis A, please do so. Hepatitis B, I'm in my 30s. When I was born, I did not receive a hepatitis B vaccine. That's something that happened later on. So we have a lot of adults who either, if they don't work in healthcare, they're not covered for hepatitis B. If they don't work in healthcare, had a job that insisted upon that. So we have adults who are not covered for hepatitis B. Try to think of anything else pneumonia. Thank you. I have a one-track mind sometimes. So pneumonia vaccines, we have Prevnar and Pneumovax. When you turn 65, you can get both. You can get Prevnar and then a year later get Pneumovax. Or if you've had Prevnar previously to turning 65, you will do the Pneumovax. So, so if you have certain health conditions, lung conditions, smoke, abuse alcohol, have diabetes, hypertension, cardiac disease, those are reasons to get a Prevnar prior to 65. So there's 2 different types of pneumonia vaccine that's available. Yes, sir.
2 quick questions. 1, what about shingles vaccine in the health department? And 2, if you received your vaccine injections at the health department, can you get a passport card issued? Are you issuing those cards?
To your first question, we have Shingrix at the health department for shingles every day. There was a point in time, maybe about a year ago, that the Shingrix was hard to come by, but we've been receiving regular shipments of the Shingrix. So that is available Monday through Friday for anybody that needs a shingles vaccine.
Is it free or cost?
For those who are Medicare age, it depends. If you have Medicare, it has to be run through your Medicare, and sometimes it does have a cost associated with it. And it varies on person to person. If you are not 65 yet, completely uninsured, and you're 50 plus, you will get a shingles vaccine at no cost. I actually try to encourage people who are 50 to 65 to go ahead and get their shingles vaccine because of issues with billing and Medicare, just being honest. I try to go ahead and have that conversation because Medicare does charge. So, and then to your second question, we're not doing vaccine passports at this point. I'm hoping to get some more direction as time goes on. Of course, we have your CDC card for the COVID shot, but we also could print your GRITS registry so you have a copy of your whole registry. But right now, we're not doing passports. I did see, just in my normal job, those who travel to Aruba who want to go without being tested, they are requiring a specific vendor to verify your COVID-19 vaccine. So if you didn't get a vaccine at Sam's Club or Walmart, it's a little bit challenging. You still can go to Aruba, they're just wanting you to be tested first. But that has come up. That's really the problem, is there's a lot of people doing different things. And this is from Aruba's official travel website. They want you to use this app, but a lot of times you have to get the vaccine from Walmart or Sam's Club to be on that app. So I hope we can get this standardized. I'm assuming that's what the CDC card's intention was when that came out. But I definitely understand the need for a digitized version. And of course, I would take a picture of my CDC card and have it on me at all times.
That's one question right there.
Okay.
I actually have 2 questions. Hepatitis A, B, and C all have influenza vaccine.
So hepatitis C does not have a vaccine.
Okay.
So yes, hepatitis B is more of a bloodborne illness, whereas hepatitis A is a fecal oral illness. So when we were having that hepatitis A outbreak, people were getting it from touching contaminated items and then touching their mouth. Whereas hepatitis B is a bloodborne infection. Hepatitis C does not have a vaccine.
So you need both of them.
You need both A and B.
And I'm kind of curious why y'all put out primary care physicians. Did you used to have dental?
We still have dental.
You do it.
Yeah, we still have dental. As far as,
Funding.
yeah, as far as funding is our biggest issue, and trying to keep the medical access clinic up and running. That's where we've done our primary care all these years. And we are losing our nurse practitioner there. That clinic's still gonna function, it's just gonna be different.
Well, I remember the dental, years ago, I took, two foster kids to go get their dental work. That's when the doctor informed me that we all had headaches. It was a really good bit.
And yes, and definitely dental services are definitely available for children in the health department. That is still ongoing.
You said our vaccination rate was 34%, but I don't have a frame of reference. Is that particularly low or is it average for Georgia? Where does that fall?
It's average for Georgia, but not good.
So where would you like, or where would the?
Well,
where-
ideally, to have herd immunity, you'd want to get closer to 70% of eligible population. You know, that's primarily the reason for these variants getting out of control is we don't have the protection in the community to stop this. It's just spreading like wildfire because we have such a low rate.
By comparison, actually, is in Georgia, 41 state.
Yes, it's up to 41%. I have Cherokee County is the only county that I service that's kind of at that level. Everybody else is in the mid-30s.
I know it's not the subject of your presentation today. By the way, thank you for everything you have done actually for me personally. You all vaccinated as well as our close friends. What is our level of spread in Victor County? High. Actually, it's the
Yeah,
high.
we're actually the whole, I looked this morning, the whole state of Georgia, except for one county on the east coast is in the high range.
High range. Okay. And the new CDC mandates recommend that we use in public places, whether we're vaccinated or not, indoors.
Correct, indoors.
Public places, indoors. Thank you, John. John has always corrected me. We were both officers for the medical staff. We've always been corrected. For like 4 decades. But anyway, so, right. Now, as of this morning, I know it's disturbing to a retired pediatrician is that we have an uptick of pediatric positive patients, COVID patients in the area. So do my practicing pediatrician colleagues tell me. And actually, one of my union partners, that's a COVID, a breakthrough infection, despite being fully vaccinated. But we're not kidding. If we don't care about other adults, we should at least care enough to wear masks indoors for our children and grandchildren that are still not eligible today to be vaccinated. I always say it, and I apologize for this, and also for my host, that brought me here. To go ahead and preach and so forth. I hated that all my life when I conducted it. Anyway, it's the Academy of Pediatrics is asking for an emergency authorization between the agencies into that. And I pray that happens. Because I have 2 10-year-old granddaughters.
I have a 5-year-old. The second it's approved, she will be at the health department.
We anticipate October, is that what the?
Yeah, 1st of October is the last I've heard.
We have an idea of the percentage of true COVID cases and vaccinated people.
We do, I was looking at those numbers this
At
morning.
the White House, they didn't,
Right.
one of the press conferences, they did not answer.
So we've actually been keeping our own records for our district, and this is just our district numbers. There is some new information out on the DPH website, but I can't quote it. But ours this morning was 4.93% breakthrough cases for hospitalizations. And then very low compared to, you're either going to get your vaccine or you're going to get COVID is what it boils down to. So, we definitely want to continue to protect those of us who are vaccinated. by getting everyone vaccinated. But we are trying to monitor those that are having breakthrough cases too. And we've only seen 2 deaths since May from breakthrough cases. And they were very senior and had a lot of other health issues too, so.
Is breakthrough mean after you've had the vaccine?
Yes, ma'am. And we're seeing those with the Delta variant. We didn't see those before
Yeah,
now.
this is a relatively new prospect. We haven't had breakthrough cases until recently. Did you have a question, sir?
Yes. Fully vaccinated back in January, February with the Moderna. Now the Delta variant, getting a booster, you recommend that, and we can just come up to the health department and get that done?
People are showing up every day.
Yeah.
Fortunately, the CDC has not given us that guidance to start doing booster doses. It sounds like those who are immune compromised may be at the front of that wave when we start doing boosters, but we have not been given a definite timetable when, but I would be glad to be right there with you.
Okay.
Well, Sherry and Ashley, on behalf of our club, we thank you for this very timely information. Let's give them a hand for being here together.